Renal Forum. Today, we are privileged to have with us Dr. Maria Akani. So Dr. Akani is a neuropsychologist as well as a psychiatrist with a rich history, 10-year history in both education as well as clinical care. She has a private practice called Renaissance, and she sees patients in both private and public sector. And she'll be talking to us about burnout syndrome, particularly among health workers who deal with patients with high morbidity and mortality. Over to you, Dr. Akani.
Okay, good afternoon, everyone. Good to see some familiar names on the list and to see colleagues. So I will not waste too much time. I'll go straight into the presentation because there's a lot to talk about and not a lot of time. Okay, so we're talking about burnout syndrome, and what we'll basically do for this session, our learning goals are that you'll be able to understand what burnout syndrome is, that you will know the effects of burnout, that you will learn what the telltale signs are, and you will learn how to manage as a team. I recognize that there are possibly 3 teams, so I'm sure you can gain enough that can support each of your teams, and that you will all get some kind of equipment on self-care. And basically, self-care is one of the ways that we can prevent burnout. So that's why it's important. Okay, and this will be the outline of my talk. We will start with a short self-assessment, and then we will talk about what burnout is, what the effects are. We will talk about team care, and we will talk about self-care. So I hope you have some kind of piece of paper or something that you can write on. We'll start with the self-assessment. Yes. And it's the Maslach burnout inventory. The first section talks about basically your feelings and so on. So you can score yourself. So this, like I said, is a self-assessment. So you're the only one who will know the results. But I think it would be good if you can be self-aware. And the first one talks about, I feel emotionally drained by my work. The first column, you can either answer never, or a few times per year, or once a month, a few times per month, once a week, a few times per week, or every day. And then the next one says, working with people all day long requires a great deal of effort. So you can just maybe put some numbers and then score each sentence just for your, like maybe you can put letters for the statements and scores in numbers so that you can then be able to calculate at the end of the day. Then the next one says, I feel like my work is breaking me down. The other one says, I feel frustrated by my work. And the next sentence, I feel I work too hard at my job. It stresses me too much to work in direct contact with people. And then I feel like I am at the end of my rope, okay? So if you look at those statements, I hope you have been able to score. The next section talks about your attitude towards patients, which is section B. The first statement says, I feel like I look after certain patients, clients impersonally as if they are objects. And the next one says, I feel tired when I get up in the morning and have to face another day at work. The third statement, I have the impression that my patients make me responsible for some of their problems. The next one says, I'm at the end of my patients at the end of my work day. Then I really don't care about what happens to some of my patients. I have become more insensitive to people since I've been working, and I'm afraid that this job is making me uncaring. So remember, nobody is going to see your answers and see that, you know, you were saying that you were uncaring, but it's helpful for you to just kind of know where you're at and be able to answer the question for yourself. So it's good if you can be as open, or should I say as honest to yourself as possible. And then the last section, section C, talks about a sense of purpose for yourself. The first sentence says, I accomplished many worthwhile things in this job. So if you feel that, you know, you never, you can say never. If you feel that you do that every day, you can score. I feel full of energy. I'm easily able to understand what my patients and clients feel. I look after my patients' problems very effectively. In my work, I handle emotional problems very calmly. Through my work, I feel that I have a positive influence on people. Then the next one says, I'm easily able to create a relaxed atmosphere with my patients. And finally, I feel refreshed when I have been close to my patients at work. Okay. So have we all scored?
Yes.
Great. So you can then be able to see what the total was for each section. The first section, which talks about burnout, if you scored less than 17 or 17 itself, then you have a low level of burnout. And if you scored between 18 to 29, it's moderate. And if it's over 30, then you obviously have a high level of burnout. And then the other thing that we talked about was depersonalization, which is section B, which was talking about how you relate to patients. And if you scored greater than 12, then you have a high level of burnout. And then section C is an inverse. So if you scored greater than 40, then you have a low level of burnout. And if you scored less than 33, then you have a high level of burnout, okay? So I hope you have been able to assess yourself and see where you are at. Okay, so what do we mean by burnout syndrome? So basically, burnout syndrome refers to a state of profound exhaustion, okay? So a person has this exhaustion physically, emotionally, and also mentally. And it typically results from having long periods of stress without significant rest or breaks in between. And I just thought that you should have a look. I think there's a slide missing, but anyway, maybe it comes a little later. But yeah, there is a study that was done, a report that was done. Medscape did a study in the US among physicians, for example. And these are some of the results that they showed, like a self-report of burnout, okay? So you can see that the nephrology unit is right up there. And my department is way low down there, 35. But yeah, and so critical care is also there at 44%, infectious diseases. So you can see that, you know, burnout is not something that is uncommon. We can see it happening even among physicians in different parts of the world. And what are some of these causes of burnout? I'm not really sure how this session is supposed to be done. Are people supposed to participate, or is it supposed to be a monologue? Hello? Can you hear me?